the fears and the social pressure out of her mind, and of the keratolytic uh, Hi guys, I'm Dr. Haroon Rashid. I'm a dermatologist. Today we are going to discuss a very important topic in dermatology, which is also so important in our social life, particularly in female section of the society. This is bromhidrosis and sometimes called osmihydrosis also. This is basically stinking of your own sweat, and the sweat usually there are two sources: eccrine glands and apocrine glands. Eccrine glands are all over the body, and apocrine glands, they are in underarm areas, your private parts, and on the breast in the females, and they are intermittent secretor of sweat, and they are activated at the puberty by the hormonal changes in the body. So, stinking of sweat of any source, whether it is eccrine or apocrine, that's so important. And today I'm more concerned and want to dive in more depth of the topic on apocrine stinking or apocrine hyperhidrosis or bromhidrosis. So these are on the special areas like underarms, like your private parts and the breast in the females. Bad odor, bad smell, unacceptable, and the patient is very sometimes irritated or anxious, and in these cases, and sometimes patient goes for a social withdrawal even, or the depression, and we should consider first of all what may be the possible sources. There is one exogenous source. There are usually bacteria like corynebacterium or staph epidermidis or some bacteria, other bacteria like that. Or sometimes there are skin infections like erythrasma or fungal infection or braided keratolysis. And in case of endogenous diseases, there might be liver disease, there might be a renal failure, or diabetes, or obesity, or metabolic disorders that can make your sweat stink and unacceptable. General measures and then very specific measure. We are going to discuss general measures. Basically, they are hygiene of the local part. First of all, we should reduce the sweat quantity. How we can reduce that? Antiperspirants that can reduce these amount of sweat secreted. Or sometimes we can take off the sweat glands and knock it out by botulinum toxin, and local hygiene by cleanser, by daily washings or daily taking bath, regularly changing the clothes. So that's so important in the hygiene of those areas. Then we can go and look for the hair that should be removed very regularly, or you may opt electrolysis or the laser hair removal, so that you can get rid of them once for all. And then the next step will be, then you have reduced your sweats over there, you have cleaned that area, and you have used the deodorants also. Then we can go for the exfoliation of the keratolytic, for the keratin degeneration points in axilla or the private parts. Here we can go for mild exfoliants like 4 to 5% glycolic acid locally. In case of antibiotics, they are never needed orally. We can give them topically. There are three very common antibiotics. One is benzyl peroxide. You may use 0.75% to 1.5% of the benzyl peroxide topically. Then comes the clindamycin 1% phosphate, and then erythromycin also. They can be used locally to remove these odor. And you should also take care of certain foods like spicy curries, like should reduce garlic and onion, and even should reduce the alcohol intake also. Must control the obesity, which can lead to the fungal infection and oversweating in those intimate areas. If the patient needs, we should never hesitate to let her consult or refer to a proper psychiatrist to take the fears and the social pressure out of her mind. So these are the steps which we can adapt to make our patient get rid of this Mostly, if the reason is found out and treated accordingly, we can eradicate the problem, we can get rid of the problem forever. And otherwise, if no problem is found, we should, at least we can advise deodorants and all the measures to here for the hygiene of the local areas, then the hair removal, taking bath and changing the clothes, and to make her or him realize that this small part of the disease, small part of the symptom, they may linger on in spite of these. These are the realities and we should have to face some time. But mostly we succeed to cover this problem very well. Support my YouTube channel and hit the button of subscription and also the notification button to get the notices of the videos like this in the future. Thank you very much for watching.